Hi, everyone. I'm Paul DiLorenzo. I'm the moderator of this session today. Thank you for joining us. If you've tuned into this, it's because you might have some curiosity about how public child welfare agencies, private nonprofit provider agencies, and community-based organizations can collaborate and achieve the broad set of goals related to child safety and family well-being. You know that real collaboration is not easy. In fact, trying to get a whole group of strong-willed, committed adults to come together around a common set of goals is almost impossible. And the thing is, these are people who are doing the work their own way for long periods of time, using their own approach with their own performance measures. And now all of a sudden we're asking them to come together and to work on a common set of those measures. It's not easy. But what you're going to see today in this short amount of time we have together is that there are some great examples out there of how professionals from all backgrounds, as well as community members, can commit to a common cause, stay with that cause over time, and really be able to ultimately improve the safety and the well-being outcomes for kids and their families. And as you think about these new opportunities for the federal Family First legislation is providing you, I would ask you to consider something. The idea of neighborhood and community-based family support is actually not so new. So we're not starting from scratch. In fact, today's social work profession stands on the shoulders of settlement houses and similar models. But I'm really happy today to be hosting this conversation. Both the models that you're going to hear about are practical examples of successful collaboration. I know both of them very well, and I've worked with them over a long period of time as a consultant, as a colleague, as a friend, and as a student of their excellence. Let me give you a few ideas of why I think they are so successful at what they do. First, they're clear about their mission and their purpose, and they have built a strong organizational culture that supports that purpose. They've been involved and engaged all of the key partners, including families in their community. They have chosen realistic strategies, and they always have a plan about how to operationalize their big dreams. In both cases, I remember telling them clearly that big dreams without a plan are nightmares. And so I think I learned so much from them in terms of how to operationalize those large scale plans that they had into day-to-day operations. Both have set their eyes on the prize, and they've been purpose-driven, not opportunity-driven. They avoid the shiny penny syndrome so common in our work. They make the connection between individual family results and broader systemic change. And finally, they realize the value of messaging their model, not only as an individual program, but as a broader philosophy and a process for how to do business. Our colleagues today that are here with us today know that what they're doing is bigger than themselves and bigger than any one agency or any individual program. They realize, most importantly, that their role is not to rescue children from their families, but instead, they've chosen to be in the business of family strengthening and community development as the primary way to keep kids safe, stable, and thriving. So I'm going to get right into it and introduce you to some of my colleagues. First, our team from Florida, Pebbles Edelman. And Pebbles, a longtime friend of mine and colleague, she is the Senior Vice President of Clinical and Community Services at the Partnership for Strong Families in Gainesville, Florida. And she is joined by another friend and colleague of mine, Patty Medlock. And Patty serves as the Assistant Secretary for Child Welfare at the Department of Children and Families. Both of them will have a great deal to tell you. And then I'm going to introduce you to my colleagues from New York, from Sunset Park, Brooklyn. First is Julia Jean Francois, who is the co-director of the Center for Family Life in Sunset Park. And Julia and I have known each other for close to 2 decades and have worked together closely on a number of occasions. And she is joined by a colleague of hers, Catherine Conroy, who is the past executive director of Help for Children, the Help for Children Foundation, and she also has been a faculty member at the Columbia School of Social Work. So with that, I'm going to get us started and hand it off to Pebbles Edelman.
Paul, thanks so much for that. Hi, everyone. I'm Pebbles, and Patty and I are going to talk for a few minutes about how our collaborative process has advanced our child welfare goals here in Florida and improved the well-being of families. Partnership for Strong Families is the community-based care agency for 13 counties in North Central Florida. We're contracted by the Florida Department of Children and Families to deliver comprehensive child welfare services to children who are victims of abuse and neglect. We also work with at-risk families to prevent child abuse and to decrease the risk of children entering the out-of-home care system. Patty?
Thank you, Pebbles. The department here in Florida provides direct services for the hotline, child abuse and protective investigations, as well as the API, protective investigations, child care, economic self-sufficiency, and substance abuse and mental health. We do have a privatized system here in Florida where we contract with community-based care agencies such as Partnership to provide those prevention services, adoption, and foster care. We have been privatized for about 15 years here in Florida, and we just recently transitioned off of our full state 4E waiver. So we've been going through quite a transition here. I wanted to start today by emphasizing collaboration and how when you have true collaboration and can really experience that, you can and will achieve positive community outcomes. DCF very early recognized that child welfare and related efforts work best when they are responsive to communities. That's why we feel our community-based care model in Florida has been so successful. By contracting with local nonprofits to perform child welfare and prevention related tasks, we're empowering the community to create their system of care that's uniquely suited to build upon their strengths and develop the services and resources that truly help mitigate our shared risks.
Our collaborations constantly remind us of the importance of relationships, something that's really universal. Relationships are critical to everything we do in our professional and personal lives. They take a lot of time, but it's always worth the investment. Our example is about relationship building at the SWAG Family Resource Center here in Gainesville. Just as DCF entrusted Partnership to identify community-level solutions to systemic child welfare issues, we too, at Partnership, needed to rely on the community to help lead our prevention efforts. SWAG, which is an acronym for Southwest Advocacy Group, approached us to open our second resource center in Gainesville. And this advocacy group was made up of a number of educated, passionate, and dedicated women who were committed to improving outcomes in their neighborhoods. But of course, there are many differences in working with a grassroots organization that would in time come to benefit the partnership, but made for some growing pains. And a couple easy to identify differences were, at PSF, we have paid staff. SWAG, they're completely volunteer driven. PSF, we have a formal knowledge of child abuse prevention, including education and experience, and we look at prevention primarily through a child welfare lens. SWAG, they're looking at a multitude of factors and disparities, whether that's crime, access to health care, access to daycare, things that are affecting a small pocket of Southwest Gainesville. PSF, we have a certain structure and rules that we have to follow as a government agency, whether it's around risk management, media guidelines, funding silos. SWAG, they're able to operate with more freedom and fewer barriers to get the job done. Next, we also noticed some recurring conflicts and issues, many really coming back to pride and ownership. And I think both of us were letting that get in our way in the beginning. So what do I mean by that? Well, the role of PSF, our resource centers are staffed by PSF. We lead the programming, we pay to keep the center operational, and again, we have that institutional knowledge of what programs and services might need to be provided. We always have to consider mitigating risk while helping people, the cost benefit, the limited resources, the list goes on. But the role of SWAG, they were leading fundraising efforts quite successfully. They garnered the support of elected officials. They established community trust. and they understood the deeply rooted needs of that particular community, which lended itself to directing programs and services that the community was actually ready for. They just wanted to help people. And a couple simple conflict examples were, who gets to talk to the media and what should that message be? Do the agency brochures reflect the partnership in a sufficient way? Do you really need to do level 2 background checks on that retired teacher? So the bottom line is there was a fear and an initial lack of trust on both sides to truly let the other guide their key areas of expertise. Patty?
And thank you, Pebbles. This is also present when you look at the larger context as it relates to the relationship between the lead agency, the community, and the state agency. Really, the state had to learn and commit to letting go of some control. You really have to learn to listen to communities, letting their needs drive your outcome data and your successes and your needs and your outcomes. You really need to listen to that community feed you the information. The overall view of the system and changes that we're all seeking to achieve always were at the forefront. So here are 2 things that we learned to do very quickly. And the first strategy is having the right people. Having the right people may sound like an easy thing to achieve, but it really does take courage for both agencies. We realized that DCF Partnership and the SWAG Center had to really look at team members who had to be key contributors. They had to buy into the culture, to believing in what we were doing together and show a commitment. So first, DCF truly had to look inward. We had to look and make sure we had the right people and the right roles, that they truly bought into the culture change of prevention and trusting in our communities and not directing, and really constant fostering of that relationship to maintain that shared vision. DCF had to do that and PSF had to do that, and we really worked as a team together to make those collaborative decisions because we were looking at the we. How do we impact the entire system, not about the me? And also just instilling in your agency the prevention, leadership's leading prevention language. We had an elevator speech that we would use to really just say this is the culture of our agency and our partners, making that a priority. And it truly worked for our system. Pebbles?
Yeah, and just to add on to what Patty's discussed, PSF had the strength of a relational rather than a transactional resource center model and a fantastic partnership with Casey Family Programs that helped us to use best practice and research to guide the services that we knew could make an impact. We had effective staff engagement, we had training resources, and again, we knew the importance of keeping the right staff. SWAG, they had members of the community that truly understood their unique needs and effective ways to encourage community participation and input. And my favorite example is of Joan and Eloise. They're sisters and neighborhood matriarchs and full-time volunteers. They could more easily tell the heart story, and that was extremely important. They felt freer to stand up at county commission meetings and express certain concerns or fears than our agency did. So this acknowledgement that we all had various strengths and neither could do the work by ourselves and alone allowed us to understand the motivations of each other, and in that build trust and working toward a common goal of improving these outcomes. The second strategy is very simple: quick, transparent, and honest communication and putting our egos aside. So although we were making great progress, we didn't get it right every time. And despite our best intentions, we seemed to still find ways to disappoint each other. That happens, we're human, and we're really busy. So we learned to start with an email or phone call from one side or the other. We get straight to the point. We didn't like how this happened, and we thought we agreed that that should have happened. And we agreed not to let our feelings get easily hurt. We would take the conversation outside of the office, over coffee or lunch. And then we would just be honest and own our mistakes and agree on ways to avoid a similar situation in the future. So to wrap up, when I look back, so much energy was spent making sure that we were each represented the right way in the beginning, that all agencies received credit for what had been done. But in the end, what does that energy really contribute to the experience of a patron walking through the door to access the clothing closet? What does it matter to the students rushing in for after school for a snack and tutoring? All that matters is that our collective efforts make the doors open to begin with. They're what put the snacks on the table. They're what gave our staff the confidence and tools to establish positive relationships with our patrons and the community. And isn't that what it's all about? Julia and Catherine, I'm going to now turn it over to you.
Thank you, Pebbles. That was wonderful to listen to and to think about the work and the incredible work that's been done in Florida. I'm going to introduce a different agency, Center for Family Life, which is a community center in Sunset Park, Brooklyn. And we're a member of the United Neighborhood Houses, which is a policy and social change organization representing 43 neighborhood settlement houses in New York City. At Center for Family Life, through a portfolio of both public and private contracts, we provide a comprehensive array of community supports. These include a food pantry, summer camps, after-school programs, employment programs, small business development services, English language learning, and child maltreatment prevention and foster care services. We serve over 15,000 individuals and their families every year. We were founded in 1978 by Sister Mary Paul and Sister Geraldine Tobias, both of whom were Sisters of the Good Shepherd. They came to Sunset Park, Brooklyn to live in community and to respond to present and emerging needs. Today, we are continuing their mission to engage with our community in partnership and to approach our work as an opportunity to learn from community members and to gain an understanding of the human conditions that confront our clients, and to share resources and opportunities that we can leverage, as well as strategies for action, all in partnership with our community members. I wanted to share a story of how we've built sustainability at the Center for Family Life over our 40 plus years of work in the Sunset Park community. This story will focus on an example of building sustainability through partnership with a private philanthropic foundation. So this stands a bit in contrast to the earlier discussion around partnership with a public funder. Help for Children is a private philanthropic foundation that operates in New York City. We applied to Help for Children to support our parenting classes, which we offer to our community in Spanish and Chinese dialects. Our goal in offering these classes was to build community strength by co-locating parenting classes in key community locations, particularly in Head Start locations. And we wanted to invite families from our child maltreatment prevention program to sit alongside with families in the local Head Start programs and to participate together. This model is unique in that it brings parenting education, which is traditionally within the Child Maltreatment Prevention project, outside of prevention only, and engages participants in a non-stigmatizing way, simply as community parents and not as, quote, clients who have, quote, maltreated their children. The foundation understood and appreciated that we wanted to engage in a community building model and that was our overarching goal and that was what was consistent with our mission. They understood that they could provide funds for us to staff the parenting groups and to provide additional supports like a hot meal when people came to participate in the groups. The groups were inspired by an evidence-informed model called the parenting journey and incorporated reflective exercises that addressed parents' immigration journey, which we felt was so critical to understanding the experience of our community. And particularly, it addressed the period of pre-migration planning, the transit experience of parents, and finally, their experiences raising children in the United States. And I mention these three things because they go well beyond the scope of what a traditional child maltreatment prevention would be paid to do in government contract. And the foundation understood that, was responsive to our mission to build community, and encouraged us to pursue those lines of inquiry with our clients through their funding. The foundation required that we demonstrate outcomes for the parenting groups. So we implemented, with their support, a pre-test, post-test design to identify gains in skill building. The design was rigorous. It included an 8-item standardized measure of social support, a 20-item parenting skills assessment. This requirement to quantify outcomes and to really look at what in the foundation world might be thought of as a return on investment, and it's a different frame than the traditional government perspective, helped us move beyond simply process measures. Who shows up? How many times do they come through the door? To actual measures of behavior change and change in people's circumstances, something that government contracts had not supported us to do in the past. The access to private foundation resources allows us to support our work and to tailor our curriculum in this case, but in all cases, the components of our programs to the very specific needs and experiences of the parents and the families who come to us. And they allow us to enrich our program offerings so that the groups are consistently, in fact, all of our programs are consistently very well attended, and we see gains in social connectedness and in knowledge of parents and their parenting practices, including things that are relevant to child welfare, like methods of discipline that don't include physical punishment, timeout strategies, and many other strengths. So in sum, the value of that relationship to the private foundation is that it gives us a breadth of resources that allow us to really be mission driven and mission focused, not compliance focused on specific outcomes, process outcomes that are the contractual requirements. With that, I just want to turn it over to Catherine so she can add some thoughts.
Sure. I'd like to make a couple of points. I'd like to start with explaining a little bit about HFC because this was a true relationship. HFC was started by a businessman, and he gathered around him other businessmen, and his particular interest was a very personal one around child abuse. And he gathered other businessmen, and it was all men to start with, to work with him to raise money in the hedge fund and finance industry. This money was then pooled and it was given away. Now, the way it was given away was they hired a number of professionals, and at the time Julia is talking about, I was the executive director, to run a committee, a grant-making committee that would decide on giving away the money. The grant-making committee was made up 100% of businessmen, knew nothing about child abuse, knew the passion of the founder, and really had a view about there's a perpetrator in child abuse, there's a victim in child abuse, and that was the headset they came with. Having raised a lot of money, they were incredibly respectful of the professionals who knew something about child abuse and allowed us to train them around the issue itself. And so the grant-making committees every year went through an in-service training. What is child abuse? Why does it occur? How one can intervene? And we helped move them off of the perpetrator-victim intentionality of child abuse into a more holistic view around the fact that child abuse happens in a context. It happens in a family and it happens in a community. And one of the great parts of our relationship with CFL was that CFL was the primary teacher of those businessmen and later on a few businesswomen who were giving out the money, that in fact it is a holistic problem, that one doesn't intervene in child abuse by only getting the dyad in a room and counseling, that one needs to look at their place in a family and the family's place in a community. And that when one strengthens community and one strengthens family, one does more to prevent and ultimately to treat child abuse than if one were only to get that dyad in a room. So the relationship was extremely important. CFL got funds. Help for Children got educated. And businessmen and women ultimately became passionate about raising money for the kinds of programs that Julia and her colleagues typify in locating in a community, strengthening a community, thereby strengthening a family, thereby preventing and treating child abuse. And that was the essence of the relationship. And I think what's important about a relationship is that it went both ways. As I said, CFL got funds, Help for Children got educated. Help for Children grew from New York City to being in 5 countries and 11 cities. And it's because of the lessons we learned in New York City that we were able to take it to Chicago, San Francisco, Ireland, the Cayman Islands, a number of other places where we could raise money in the finance industry and then give it out. So from a funder's point of view, I'd certainly like to say thank you to Julia and her colleagues who probably did more to train our grant-making committees than all the professionals who troop through telling the stories and the data.
Thank you, Catherine, and thank you for your kind words. I want to end with describing one of the most significant challenges that we face in our work as community-based providers, and that's how to provide truly holistic services and comprehensive services with limited government funding. Building relationships to partners is essential in getting this done. One of the most significant challenges that I face in my work as a director is the task of cobbling together an organizational budget from diverse funding sources. We would like to see that our organizational budget in its totality will support this comprehensive portfolio of enriched services for community that will strengthen community. Over many years of community service, we've seen that having an integrated array of services where there is no wrong door for families, and families can access child maltreatment preventive services by first learning about us through their after-school program or through our food pantry, is incredibly critical to our being able to build strength and resiliency in the neighborhood. Government funding is by and large siloed, and it's not offered with guidelines for how to consider implementation of a government contract in a community context where an organization that might be engaged in preventive services will be at the same time deeply engaged in other complementary community services like after school or other legal services or other services that are very much connected and needed. The importance of the private foundation support, like the support we received from Help for Children, is that it allows us to bridge across government contracts to develop complementary, accessible points of entry and to provide opportunities for families to engage in many different ways. Private foundation funders are generally acutely aware of the limitations of government contract funding, and they serve a critical role in making it possible to first and foremost simply pay the actual cost of providing service, which is generally not covered through government contract, and second, to enhance services so that they can be made most meaningful and relevant to the community that an agency would serve, in our case to Sunset Park. And with that, I'll just turn it briefly over to Catherine to wrap up.
2 examples of funding and general operating costs. When I was at Help for Children, it was not that hard to convince the grant-making committees, again, made up of businessmen and women, to fund general operations. They understood the cost of turning on the lights, putting on the heat, having maintenance workers. They understood that because they came from business, and they were not as siloed as government funding is about turn this knob, do this, have this outcome. They understood more, again, holistically, that different kinds of money are needed to achieve a single aim. And so it wasn't that hard to get them to provide what we kept calling the glue. The glue. If Julia could not serve a meal, if she could not help pay for transportation, people were not going to come to her groups. So you can put all the money you want into the groups, but if you don't get the folks there and feed them while they're there, they're not going to come. And so we referred to that as kind of the glue money. It allowed us to glue pieces together through our granting so that people could actually do whatever the project was that they wanted to do. So Help for Children understood that. I'm also very proud to say that I'm currently the executive director of the Kenworthy Swift Foundation. Now, we're a small foundation, and we grant only in the area of clinical and mental health services for children and youth. The board unanimously 2 weeks ago endorsed the resolution that we will only, over the next year, fund general operation. That the last thing with the pandemic that's going on and the other things in our society that are cutting into our availability to provide good services, the last thing we need is to have people start new projects, to start little projects. We want folks to think larger, and we want them to use our money to leverage other money to think larger in a time when we're trying to deal with different kinds of viruses, including racism. So both examples of larger, business-oriented operation charity that raised money from the finance industry, understood the glue money, understood operational grants, to a small 60-year-old, slightly lowly endowed, it's a $10 million endowment, charity that could move from we're funding small projects and we're looking at discrete outcomes to no, in this time, at this place, we need to fund something larger, and we're going to do it through general op. And I think the idea of general op is something that's gathering steam among the foundations. Some of the very large foundations are moving towards that. I think many of us need to look in that direction so we can give the kind of support to Center for Family Life and other organizations like them that they need. And with that note, I'll turn this over to Paul, who's going to lead us through a panel.
Well, thanks to all of you. That was really fantastic. And, you know, some of the information today wasn't necessarily new, but just the way you framed it was so important. And I hope those people who are listening in, especially those of you from public child welfare agencies, hear some of the kind of twists and turns that need to happen for us to really accommodate these community-based and neighborhood-based family support programs. Let me just highlight a few things that I heard. I really value this idea that Pebbles raised about engaging community members as paid employees, right? That's a community development component of this work. I think it's important to pay attention to another one of the points, which is how every one of the organizations involved here are always devolving both for contact with the community and flexibility, right? Patty to the CDC in Florida and the CDC to its neighbors, right? So each agency looking to find the other partner who has the flexibility and that kind of shared intimacy with the community. How to use other resources other than money, right? The old adage of time, treasure, and talent. Both of your organizations have been really good at figuring out how to use those partnerships. Keeping your eye on the prize, right? That no matter what you do, no matter how many times there's conflict, disagreements, et cetera, that you're always focused on the kids and families. I like the fact that in both cases, community development is an important part of the work that you do. I like the fact that what is popular and what is progress with the community that you serve isn't necessarily always the mandated measurement of public child welfare agencies. And I think that's a struggle, right? Because we know what resonates with the community, what resonates with neighborhood residents in any jurisdiction, doesn't matter, Gainesville, Brooklyn, anywhere. But what's important to the community isn't always measured by the traditional child welfare standards. And I think that that's important for agencies to think about. And then I like this point that Catherine made about allowing funders to learn from your work, right? That it's not necessarily a one-way street where they're writing a check and hoping for the best. There's really an engagement of the two entities so that you can learn from each other and benefit from each other. So we have a few questions that we're going to ask in the context of this panel. Again, it's not the same as if we were in person, but we're going to try to make it work as best we can. And the first question I have for the panel is, if I'm a public child welfare agency director, or I'm in a county agency, state, doesn't matter what level I'm at, how do I trust that these community-based and neighborhood-based programs are going to help me achieve the outcomes that I think are important, that I'm going to be measured on? How can I be trustful that what you're going to do is going to ensure the safety and well-being of kids? And Patty, I guess I'll start with you as the lead here from a public child welfare agency.
Thank you, Paul. And I think that is just such a great and important question to start with, because you can't really achieve a whole lot if you don't have trust. So, from the very beginning, from the state perspective, we had to really consistently recognize our partners and our entire system and our communication. When you're the state agency, you have to first earn their trust, earn your community's trust, because we would recognize when we would come in, you had to create an atmosphere where people felt freedom to share and freedom to speak and freedom to elaborate and be creative, and really developing their story and trusting us to come in, as well as us learning trust of them to build our story. So one thing we did was we built our data story around what the community identified. And we really looked at how they identified, how are we going to get there from here to reach our outcomes? How do we develop our shared outcomes? And really fed that to us versus us telling someone you have to get here this way and how and when. Again, I got to go back to letting go a little bit, letting go of that control of the agency, and really truly have that trust to get there. It took some steering along the way. I mean, we have to, get where we're going, but people and relationships were everything in this process. And I think investing that time was key to getting that trust relationship so we could move forward.
I think the only thing that I would add, Patty covered all of it really well, is to say that at our particular resource centers, we use every opportunity we can to make sure that people know that we would not be successful without our partners providing services and our volunteers helping to serve our patrons. So we want to make them feel recognized for playing that critical role that they do as often as possible.
I think that I just second all of the points that Patty and Pebbles have made. I think they've highlighted the importance of open communication, transparency, allowing the partner to really be part of understanding why certain data is being collected and to see it regularly. I think with the private foundations, there's another element of that goes into trust building, which has to do with the reputation of the organization in the context in which it's operating. Philanthropic relationships are very intimate with the organizations that they fund. And so there's, I think, an attention to sort of how you are positioned in your larger context and whether the foundation feels comfortable with you as a partner. So the more transparency, the more availability of data, financial activity, et cetera, the better. Catherine, I don't know if you want to add additional thoughts to this.
First, I want to say that I have also been on the other side. I mean, currently and most recently, I've been a funder, but for many years, I was on the agency side trying to raise money. So my comments come from both. I think that accountability on the part of funders needs to have a number of ingredients. One, reporting requirements should be minimal. I am astonished, having been both a recipient of funds and giving away funds, how some funders are so enamored of their own importance that they make the reporting beyond a doctoral dissertation. It's absolutely absurd, the amount of data that you have to turn in. So I think it needs to be minimal. I think it needs to be clear. Everyone should understand what the reporting requirements are well beforehand. And because it's a relationship, it should be agreed on, not just imposed. I think it should be doable. As a funder, I don't need a regression analysis, but a pre and post test, this is very helpful. So I think it should be doable. Finally, I think it should be useful. I don't think it's of any use to anybody, and it's a waste of everybody's time if funders are asking for material that gets a check-off box while they sent in the material that I asked for, and it's of no use. So when I was at Help for Children, we often would call up agencies that we had funded and say, hey, we thought your reporting was really good. Can we share it with another agency that's having difficulty? And have them use it as a model for them doing their reporting. And the last thing is, I think the best reporting in terms of a relationship is that it also gives you examples for implementation in the future. So if I get a report that shows that an agency has cracked a problem that other agencies have had, that we're able to move that example to the other agency. And one I'll give you is and it actually, I think, goes back to Center for Family Life. we had an organization that wanted to work with fathers who had been adjudicated as having abused their children. And so they tried to run a group for fathers who abused their children. This was not really helpful because nobody would come. Extended Family Life was one of those kinds of organizations that put together a job program and invited men in to explore jobs. And while they were in the jobs program, they got all kinds of group work on child development, which included disciplining your child and understanding child abuse. So that was a great example of one group that we funded having an example that we could then give to other groups to implement. And so I think that part of accountability is also using that relationship both ways.
That's really good. I was just writing a note to myself, Catherine, that community agencies all over the country were cheerleading you as you were talking about the evaluation. So I think you just made a whole lot of new friends. Let me jump right into the next question, which is, and Julia, I know this, I think, from knowing your founder, both of your founders, and also Pebbles from being in on the early conversations when you all got started. And that has to do with how do you create these partnerships as private agencies, as community-based agencies, at the same time that you're working with public agencies who have broader, bigger goals. How do you maintain your agency's mission and purpose, knowing that Patty and others have very serious and important mandated goals that they have to achieve, but in the same hand, you have a board, you have traditions, you have a history, you have a mission, vision, and purpose. How do you make all that work? And let's start with Julia in the little bit of time we have left here.
I'll be very brief. Thank you, Paul. I'll be very brief. I think that what I learned from Sister Mary Paul, who was our foundress, was the importance of keeping the mission as your guide star. That anything that takes you tracking away from the mission of community building, community development, and partnership is a distraction. So I think that for us, the partnerships come organically out of our expressing to everyone who will listen, our deep commitment to engaging our community in the development of programs that will give voice, that will include encouragement for civic participation, that will help people gain ground in their lives, in their community. And so when you are so clearly driven by that and express that as your initial sort of elevator speech or welcome, I think it helps you to ultimately create partnerships that will be consistent with that. I'll end there.
Pebbles?
Thanks, Paul. And Julia really highlighted almost all of the important points. I would say that one more thing people could consider doing is partners need to be an actual part of your agency's mission or vision. So as a brief example, Partnership for Strong Families' vision is to be a recognized leader in protecting children and strengthening families through innovative practices and highly effective, engaged employees and community partners. So you can actually embed this idea of partnership in your agency's success from the beginning.
Patty, your perspective from your public agency perspective.
I think that as a state agency, we have to find ways, and you have to show leadership commitment that you pass the baton on throughout your system and stay focused. But it's exactly what Pebbles just said, and Julia, you have to take what the community is saying, take their vision and where everybody wants to go, find your common ground, and you have to you have to express that your state is committed to that vision and mission. And I know that sounds hard sometimes for states, but I think when you really look at, we have common outcomes that we want, where we want to go together. And I think when you just keep that and you really show dedication and make a commitment as a state, you can get there together.
And Patty, I don't think it's any accident that you're here today. You've had this work in your heart for a long time. I think I know that as having worked with you, and that it was always unclear to me and I mean this in the very positive sense, that you were a state official, that you were somebody who was representing the state government, because your demeanor and also your approach was to be very inclusive of the community and the neighborhood in which you were working. So I commend you for that. But again, I think not everybody's comfortable doing that, especially in a state or county government role. So let's go on to the next question. It has to do with maintaining relationships over time. I think all of you kind of alluded to this, but it can get tricky. People get on each other's nerves, or they have little conflicts, or they let their ego get in the way. Julia, what have you done in terms of this kind of daily contact with people? And Catherine, you two maybe could answer that question together.
Just briefly, with the foundation relationships, I think that communicating often and having your doors be open and being very transparent about what your activities are and how you're tracking to goals is the best way to create an ongoing relationship over time. I think that what Catherine pointed to about the mutual learning is also critically important. In the foundation relationships that we've had, where we've been able to be in the role of learner and teacher, and that the foundation partner was able to assume both of those roles as well, I think we formed the most long-lived relationships. And that goes beyond child welfare. That's pretty much in every domain where we would engage a foundation partner. So being able to recognize that everyone in that relationship has something to offer and something to learn is, I think, the bedrock of real long-lived relationship building. Catherine?
The only thing that I would add is that absolutely everything that Julia said, but as a funder, I'm most interested in communication when a grantee is telling me there's a problem. They tell me they can't make a goal since things have changed and they can't do what they plan to do, or they feel that they're falling short. Any problem that they raise tells me that they're being transparent and that they're being honest and they're being open with me. And as a funder, that's the best kind of communication possible. I don't need to know that they're doing well until the quarterly report or the final report. I really don't. I don't need them to call me every day and say everything's good. I need them to call me the minute they're worried about a problem, either with their board, their community, their other funding, their delivery of service. That tells me that we have a relationship, and then I'm much more inclined to stay with them in the future.
And I would think in Florida, this is especially important because of the privatized nature of your system. Patty, I just asked you to comment quickly on this one, this issue around kind of the working relationship. How do you kind of deal with all of these private CBCs that, in some ways, they're kind of the king or queen of their domain, and that's a challenging one for you.
It is. It really is. It can be quite challenging. We look at, you weigh out your benefit to, when we had this system as the state, I was there when we had it under state guidance, and it was not, we did not get where we wanted to go. So I think, navigating relationships, and again, it's relationship building, working together, collaboration. You have to become a really good mediator, I think, and negotiator and working together, because there's very strong, opinions and needs and where they want to go. And again, as the state, you really have to figure out how to meet in the middle so that you can, again, just keep our outcomes in mind. And a lot of hard work, but we think it's worth it because we've had such great outcomes.
Well, this has been really great. I've learned so much today. As always, I walk away with a great deal more than when I started. And I have a few more takeaways that I'm hoping that the group will hear, all of those who are kind of tuned in today. The first is the importance of working on those relationships so that everyone's focused on the same common vision and making sure that you're continuing to sustain and nurture those relationships. The importance of remembering and realizing that you're dependent on each other, that no one agency or individual or organization can manage something of this scope and size and complexity. That's the first. I think the second takeaway from this part of the conversation was that every one of you have had a big dream and a large encompassing vision. And it's also important to note, though, that everything that's happened, all of your success, has been the result of intentional planning and taking the time to think things through, making sure that you have those really difficult and courageous conversations that you're going to need to have, but that you think about the detail of this work. It isn't necessarily something that occurs through a 3-ring binder. There aren't necessarily blueprints for this, but thinking things through with your group so that there's a plan attached to each one of the dreams that you have. And then finally, Family First can be a real asset to the states. It can be a real asset to programs like yours. And as we go forward, you'll have the opportunity to think about how that new legislation impacts the work that you're doing. Thanks so much to all of you who attended. We really appreciate it. I hope you've learned as much as I have. I'm wishing you a good day.